Edmonton Mill Woods, followed by the honourable member for Drayton Valley, Alberta.
Thank you, Mr. Speaker. Yesterday I raised some crucial questions about the health and safety of human services workers in this province. Unfortunately, I was not able to get the answers that these workers need, so today I will try again. Workers in the Department of Children's Services report the second highest long-term disability rate in government. Overall, many workers feel that the Department of Children's Services has failed to completely implement basic occupational health and safety measures. My question is to the Minister of Employment, Immigration and Industry. What is the Minister doing to help Children's Services fully implement occupational health and safety standards?
The Honourable Minister.
Thank you, Mr. Speaker. As I have identified in this House on a number of occasions, the standards, occupational health and safety standards, apply equivalently to all of those members of our staff that are covered. And so the questions that were raised yesterday, I've already asked my staff to make sure that we are networking with Children's Services to determine whether or not there is a concern that has been expressed that we should explore. I certainly take very seriously the mandate of trying to make the workplace as safe as possible, and so we have taken that consideration, and I will be hearing a report back, no doubt, and we'll share that with the honourable member. I know that the honourable member shares concerns about workers.
The honourable member.
Thank you, Mr. Speaker. Compassion fatigue is a tremendous problem for human service workers. The nature of social service work and constant case overloading can be both physically and emotionally draining. Of all Alberta government employees, workers in children's services comprise the youngest workforce but report the highest use of the Employment Assistance Program, which deals with the emotional, psychological health of government employees. To the Minister of Employment, Immigration and Industry, what is being done to work with the Minister of Children's Services to reduce the physical and emotional toll caused by compassion fatigue?
The Honourable Minister.
Mr. Speaker, that's very specific to the compassion fatigue, and I think that there's a necessity to explore that. I would just say that in 59 centres where we also have in employment, immigration and industry, many counsellors, many social workers, many people that deal with compassionate issues related to low income, sometimes very difficult social circumstances in terms of children's benefits, in terms of family conflict, in terms of those kinds of circumstances which are stressors in family life. We have many social workers as well who do a very determined job to try and follow through on behalf of the clients as well as gain support. So we'll look at that in that.
The honourable member.
Thank you. Social service workers are often forced to enter alone into situations that armed police officers would not enter without their partners or flak jackets. Workers have told me that they have been called at home and told not to go to work the next day because the threat is too great. All too often, social service workers are exposed to death threats, presence of minor weapons like knives and baseball bats, and illegal drug use. To the Solicitor General, the main problem is that human service workers do not have access to the criminal and police records they need to identify clients that are a potential risk. What is your department doing to facilitate access for these workers?
The Honourable Minister. Question.
Thank you, Mr. Speaker, and the honourable member raises a very legitimate concern, and we are doing everything that we can in our department to ensure that all of those who work in the social programs have the information that they require to deal with their clients in an appropriate manner, Mr. Speaker.
The honourable member for Drayton Valley, Kalmar, followed by